Hello everyone. Today we are going to discuss about a very interesting topic, Guillain-Barre syndrome, wherein body's immune system attacks the part of peripheral nervous system. Peripheral nervous system consists of sensory nerves and motor. It is an acute progressive autoimmune disorder. Sensory nerves carry information from organ to brain and motor nerves carry information from brain to organ. If these nerves are being damaged, then how the electrical impulse is being transmitted and how response will be occurring. Why does it occur? Main question comes up is, why does Guillain-Barre syndrome occur? There is no confirmed cause of Guillain-Barre syndrome, but 60 to 80% of patients of Guillain-Barre syndrome has some sort of previous infection of bacteria or a virus. Most of the patient has infection with Campylobacter jejuni, a bacteria present in the contaminated water and undercooked poultry. Patient will initially get diarrhea, high grade fever, pain, muscle ache that will not subside easily. After subsidization of fever, after 2 to 3 weeks, sudden tingling sensation and weakness will occur from the toes to the ascending order, from toes, legs, arms and hands to the sensory organs. Why does our own immune system mistakenly attacks our peripheral nervous system? So here, Campylobacter jejuni is a bacteria present in the contaminated water and undercooked poultry, consists of a shape or a composition similar to the peripheral nerves of our body. So our antibodies, our immune system will get confused. They have to kill our peripheral nerves or they have to kill the bacteria. So between this confusion, they mistakenly attack on our own peripheral nervous system. From there, GBS symptoms get started. After 2 to 3 weeks of diarrhea, sudden tingling and weakness sensation will experienced by the patient. Now, most important question is, when to suspect Guillain-Barre syndrome? Rapidly progressive bilateral limb weakness or sensory deficit. Patient will not be able to move limbs suddenly. He will also be confused that why is it happening so. Facial palsy, water dropping out from the mouth of the patient. Ophthalmoplegia, eyes dropping, and ataxia. Patient is not able to balance himself. The gait is not balanced or coordinated. How GBS is diagnosed? The first diagnostic procedure is lumbar puncture, wherein due to hindered blood nerve barrier, as we have seen, nerve myelination sheath is destructed, so the elevated proteins from the blood will enter into the nerve, so that is increased the number of proteins in the CSF. Second diagnostic procedure is electrical test of nerve and muscle function. In this procedure we will assess the electrical impulse is passing or not. Now, most important aspect of Guillain-Barre syndrome is when to start treatment. If patient is unable to walk more than 10 meters independently, there is a rapid progression of weakness or severe swallowing dysfunction. Why there is a swallowing dysfunction? We have peripheral nervous system consists somatic nervous system and visceral nervous system. Somatic nervous system controls the voluntary function and sensory function. Autonomic nervous system controls the involuntary smooth muscles and glands. Voluntary muscles consist of limbs, lower and upper extremities, and sensory organs such as taste, eyes, nose, and touch sensation. Whereas autonomic nervous system consists of respiratory function, digestive function, cardiac function, bowel and bladder function, and some sort of reflexes such as swallowing, vomiting, and sneezing. That's why this is also affected. Autonomic nervous system is also affected. That's why severe swallowing dysfunction can be there. This is also a smooth muscle and respiratory insufficiency will be there. Then we have to start treatment of Guillain-Barre syndrome patients. What are the treatment options? There is no exact cure of Guillain-Barre syndrome, but with multi-system approach and professional guidance, symptoms can be relieved and recovery can be faster. Treatment include plasmapheresis, IVIG, and rehabilitation. Plasmapheresis. It's a machine that will filter the blood to remove antibodies from the plasma that are attacking nerves. We have seen that antibodies are attacking our own nerve cells. That's why they need to be removed out from the body. That's why plasmapheresis is done 200 to 250 ml per kg for 5 sessions. IVIG, IV immunoglobulin from donor plasma, that are healthy immunoglobulin given to patient with the dose of 0.4 gram per kg daily for 5 days. Now the question will be, why the patient is given IV immunoglobulin even after patient have already antibodies increased in the body? Answer is, even though they have elevated immunoglobulin, IVIG contains antibodies that are designed to block or neutralize the harmful antibodies causing the nerve damage. These are the treatment options of Guillain-Barre syndrome. Next important part is monitoring of patient. Patient is in ICU. Patient respiratory function is hindered. Cardiac function is hindered. All smooth muscles as well as voluntary muscles are hindered. So it's important. This is all collaborative difficulty patient is facing. So monitoring of patient in all aspects is very necessary. Regularly assess muscle strength. Very important. Patient is paralyzed. Muscle strength should be assessed. Ask patient to hold your hand, to lift their hand, etc. Respiratory function. Keep the head end of the bed elevated to maintain saturation of patient. Swallowing function. Patient is not able to swallow also and take up choking things also. So suction properly to avoid saturation drop. Assess autonomic function as well. BP, heart rate, bowel and bladder control. This is monetary aspect of Guillain-Barre syndrome patients. Now, rehabilitation. Due to voluntary muscle paralysis and autonomic dysfunction, patient faces many difficulties. Rehabilitation should be started as early possible. After plasmapheresis and IVIG treatment, 90% of patients will move on to rehabilitation phase within 4 weeks. So, rehabilitation should be started with assistive devices such as cranes, wheelchairs, and occupational therapist, speech therapist, physiotherapist. Patients should try to regain their mobile activity.